This is the Experts Talk program on Kazakh TV. Today we've dedicated our episode to such a relevant topic as collective immunity to Covid-19. Down the line from the Russian Federation, Doctor of Medical Sciences, Professor, Director of St. Petersburg Research Institute of Epidemiology and Microbiology named after Pasteur, Areg Totolyan. Hello, Areg Artemovich. Good afternoon. It is known that scientists of St. Petersburg Research Institute of Epidemiology and Microbiology named after Pasteur are investigating collective immunity to coronavirus infection. Please tell us about the first stage of the study. How many people took part in it? How were these studies conducted? Assessment of population immunity in the Russian Federation to the coronavirus infection is a program of Rospotrebnadzor, which was developed in May. Already in mid-June, a pilot project was launched, in which 3 regions took part: St. Petersburg, Khabarovsk and Tyumen. We took different districts, different regions of our large country to understand how the algorithm works. After the pilot project was successful, we extended the experience to other regions of the country. Today, 26 regions participate in this program. And in 26 regions, at the first stage, more than 74,000 volunteers were surveyed. There were no contraindications for participation in the study. There was only one exclusion criterion, that is the presence of coronavirus infection in the acute phase. All other volunteers, if they were ready to donate blood, because it is impossible to evaluate antibodies without taking blood, were allowed to study. We have identified 7 age groups. This is from 1 to 17 years. We call it the children's group, but within this group we have already divided further in the analysis, from 1 to 6, from 7 to 13, and high school age, respectively, from 14 to 17. Further age groups from 18 to 29, and further every 10 years, and the last age group is 70 plus. The second stage began in the first week of September. It has already passed in 5 regions. It has been completed. Now we have started processing the results. In the remaining 18 regions, it is still ongoing. Based on the results of the first stage of this study, which city or region has the largest share of residents who have antibodies to coronavirus? Of course, the range is wide enough. For June-July, the range was from 4%, for example, in the Republic of Crimea, there is 4.3%. Up to 31% in the Republic of Tatarstan. This maximum level was at the end of June, beginning of July. That is, from 31% were identified. Yes, antibodies to the new coronavirus. Is it authentic information that, as a result of your research, you found out that retirees aged 70 and 70 plus who live with children and grandchildren are not necessarily in a high-risk zone? It all depends on a number of factors. If an older person is single, he is less likely to become infected, but he is equally less likely to be passively immunized. Because if he observes all the restrictions, even to the point that he does not go out shopping himself, but uses a courier service or uses the help of social services, his contacts are minimized and consequently risks of infection are minimal.
У него контакты минимизированы, и, соответственно, и риски инфицироваться у него минимальные. Если пожилой человек...
If an elderly person lives in a family, in a large family, where there are not only grandchildren but also great-grandchildren, the risk naturally increases.
Потому что контактов больше.
Да.
Но
Because there are more contacts. But there is another circumstance that children suffer either in an asymptomatic form or what is called on the run.
или, то, что называется на ногах.
And then there may be passive immunization of the older generation. I can demonstrate this to you using the results we have obtained in St. Petersburg. Since in St. Petersburg this study was organized online.
Получили по Санкт-Петербургу.
For the most part, the elderly who came to us used the help of young people who helped to pass the questionnaire survey.
Пожилые, которые попали к нам в исследование, они пользовались...
Then receive an email with an invitation letter and so on.
Помогало пройти анкетирование.
That is, there were much fewer single elderly people in the study than in other regions.
И так далее. То есть у нас одиноких...
As a result, we got a situation that the age category 70 plus was in the second place after preschool children and children of early school age.
Ситуацию, что возрастная категория 70+ была на втором месте после детей дошкольных.
At the first stage, I can even give you numbers. On average, for the region in St. Petersburg, the size of the immune layer was 26%.
В среднем по региону в Санкт-Петербурге величина иммунной прослойки была 26%.
Among children of preschool age, the value of this layer was 38%.
Составила 38%.
Among children of primary school age was 31%. And among the elderly 70 plus, it was 30%. And the percentage of the active working population, 30, 40, 50 years old, was about 20. You can compare how contacts with grandchildren and great-grandchildren affected the size of the immune layer among the 70-plus category. Is it possible to draw conclusions about the most protected age category based on the first stage? That is, let's look at this issue again. Does the presence of immunity indicate protection? I suppose it is the most important issue, and of course it should be solved from a scientific point of view. Should not be solved within the framework of assessing population immunity, but should be solved within the framework of a survey or observation of those who have recovered. For example, at our institute, a cohort of patients has been formed. It is about 350 people whom we observe. We can say that within 5 months, antibodies are not only produced, they hold. They do not disappear anywhere within 5 months. But there is another circumstance. There are people with high level of antibodies, and there are people with low levels of antibodies. And a very important question, if the level of antibodies is low, they will persist in 2 months, in 3 months, in a year or not. Do these antibodies protect or not? To date, it is clear that, for example, in St. Petersburg, 26% of those who had antibodies at the first stage are not all protective. But it would be strange if everyone had protective antibodies, because there is passive immunization. This passive immunization occurs primarily in children. And in the second place, are elderly who come into contact with children. But the production of antibodies is a case about the viral load, about the dose of the virus that a person received. If a small dose of the virus, it is clear that the immune system will respond even to this small dose of the virus. And antibodies will be produced. But immunologists are well aware that the higher the antigenic load, the higher the quality of antibodies is also in terms of functional activity, that is, the ability to bind the antigen and impart the quantity. So the level of antibodies is higher. A very important question. According to your forecasts, when will collective immunity be formed? Collective immunity is what we have to come to. Until we have a collective immune system, we will not be able to cope with the epidemic. So another question is, how will collective immunity be formed? Either naturally or artificially. Naturally is when everyone in turn has to get sick, until a layer of 70% is formed. Then we will not have an epidemic. 90%, then we will not even have an increased incidence. Or artificially is through vaccination. Which model do you follow?
I am an adherent of the mixed model, because neither a single country nor an organization is able to completely isolate individuals from the outside world.
On
the other hand, it is wrong to wait until the entire population is immunized naturally from the perspective of the 21st century. Because vaccination of the population and the effectiveness of vaccines against most infections have already been proved by life. It's up to the man to be sure that the vaccine that has been developed is effective. That's basically what we are going for now. And when there is such confidence, you need to use both options. Natural immunization and immunization through vaccination. What other areas do you work in with your colleagues? The first employees of the Institute were involved in the problems of coronavirus infection in late January, early February. And the Deputy Director for Innovation, Professor Simonov Alexander Vladimirovich, went to China twice. He was included in the WHO team of experts on coronavirus infection. He participated in the testing of the first Russian test system, the PCR test system, which was tested in China. Then he worked in Italy, when a group of our military epidemiologists and toxicologists, hygienists, conducted work. And now he and a team with Rospotrebnadzor employees has been working in Tajikistan for 2 months. This is one direction in which the Institute has worked from the beginning. The second direction is the development of our own PCR test system. Such a test system was developed, and registration in the Russian Federation was received at the end of May. Since we were not the first, we managed to consider certain shortcomings of our predecessors. With this test system, we get a fast response, and the most important thing is that the quality control of the analysis is carried out at different stages of PCR analysis. So if we get a false result, we immediately see in what stage we got false results, where we need to adjust. This test system is currently being actively produced. This is the second direction. The third area is diagnostic work. And our institute has organized a laboratory for the diagnosis of coronavirus infection, which opened on April the 8th. And it works around the clock. Regarding the first direction that you mentioned, China and Italy, what is the most basic and important useful conclusion, not only for the Russian Federation, but also for science in general, during this work?
этой работы.
Самое ценное в моей
The most valuable thing, in my opinion, is the experience that we got.
получили. У нас была возможность учиться у
First of all, we had the opportunity to learn from our Chinese colleagues, because in Italy, when the situation spreads, we already had an epidemic.
уже эпидемия поднимала голову и у нас.
But when in February twice delegations went to China, everything was still quite calm in the Russian Federation.
Вот в Российской Федерации все было еще достаточно.
And we had the opportunity to observe what correct decisions were made by the Chinese side.
Принимала китайская сторона, прежде всего.
First of all, organizational measures and management decisions. And this, in my opinion, is a very important nuance that made it possible to make the right decision on the territory of the Russian Federation. This experience was irreplaceable.
Правильное решение. Этот опыт он
And in general, not only the experience of China, but the experience of all countries is irreplaceable, because each country has its own specifics, its own nuances. What is your opinion on the second wave of COVID-19?
Я не считаю, что
I don't think this is the second wave.
продолжение первой волны. Все-таки
I believe that this is a continuation of the first wave. After all, when we are talking about the second wave, it means there is an epidemic process.
это время начался
Now it has ended, a new epidemic process has started for some time, and then we are talking about the second wave.
вот в Российской Федерации.
What is happening, at least in the Russian Federation, what is happening in our hometown of St. Petersburg, these are all different stages of the same process.
Естественно, мы видели снижение,
Sure, we saw a decrease in the incidence of diseases in August.
сопряжено с тем, что в июле, когда
In my opinion, this was due to the fact that in July, when many restrictive measures were cancelled and the active holiday period began, the population from megacities went to the countryside and many went in the direction of the sea,
было за город, и
primarily the Black Sea, but not only.
море, прежде всего Черного моря,
The most reasonable, the steadiest, are summer residents.
наиболее трезвые.
After all, it is calmer in the summer residents. People began to return from vacations, people began to return in connection with the beginning of the school year, and the population density increased
С
again.
началом учебного года. Опять
Of course, there are a lot of factors, but in one of the first places is the population density.
одном из первых мест это плотность населения.
The population density dropped in August, but we saw a decrease in the incidence.
Заболеваемости. Плотность населения.
The population density increased at the end of August, and in September we got an increase.
Мы получили рост.
In this case, when will the first wave that we're talking about now end?
Мне кажется, что
It seems to me that at least in the near future, in autumn,
ближайшее время, которое
winter and early spring, we will still have an increased incidence.
началом весны, мы еще будем
If the following doesn't happen, in other words, tomorrow we start blanket vaccination, which turns out to be more than successful, everything stops. The epidemic stops.
полную вакцинацию, которая оказывается
There may be such a scenario, but I do not think that we are now ready for blanket vaccination.
Но я не думаю, что мы
There is a vaccine. The vaccine is currently undergoing extensive testing.
сейчас проходит расширенную апробацию, но нужно еще
But we also need production capacity, thanks to which the vaccination will be available to the population of the whole country.
населению всей страны. Но если мы будем действовать в отношении таргетных групп, прежде всего профессиональных
But if we act in relation to targeted groups, first of all professional groups, who are the most vulnerable?
вместе, это работники образования,
In the first place, these are medical professionals.
и это правоохранительные органы, которые обеспечивают
In the second place are educators. The third is the service sector and law enforcement agencies that ensure our safety on the streets.
в первую очередь, конечно, надо было бы вакцинировать. И
These are the main occupational risk groups that first need to be vaccinated, and if they have immune protection, then the spread of the virus will be much slower.
вируса будет происходить, конечно, гораздо медленнее.
Thank you very much for such useful information. We wish you and your colleagues good health and, of course, all the best. Thank you so much. I'm Areg Totolyan. Take care. See you.